In this video, you are going to learn how to do arthrokinematic assessment and treatment for the ulnar capsule of the radial carpal joint. Hi and welcome back to Physiotutors. The aim of Rolle glide assessment is to gain information on reactivity of the joint and articular problems such as capsular limitations. For the push technique, have your patient in sitting position with the forearm in neutral position and supported on the bench. The patient's wrist is hanging freely. Then fixate the patient's forearm on the bench and grab the patient's proximal intercarpal row from radial. The intercarpals are the convex joint partner and the distal radial ulnar joint is the concave joint partner. So when moving with the convex joint partner, we will have to roll and glide into opposite directions. Now roll into radial and distal direction and at the same time perform the glide by pushing the proximal intercarpal row into ulnar and proximal direction. The proximal component is added as the distal radius reaches slightly more distal than the ulnar. An alternative is the pull technique. For this technique, the patient is either sitting or in supine position with the flexed elbow on the bench and the forearm in neutral position. The examiner is standing or sitting distal to the wrist to be assessed. Then fixate the patient's forearm with one hand and grab the patient's proximal intercarpal row from radially, like in an arm wrestling position. Now roll into radial and distal direction and at the same time perform the glide by pulling the proximal intercarpal row into ulnar and proximal direction. The proximal component is achieved by approximation. So you are pulling, but at the same time you are also pushing the intercarpals towards the radial ulnar joint. For all techniques, assess for movement quality during roll and glide, possible pain provocation and end feel. For end feel assessment, roll and glide to end range, then assess if further gliding is possible or not. In a hypomobile joint, the glide is reduced relative to the roll component, so no further gliding is possible. If you feel that the end feel or movement quality is abnormal, you can directly move further from assessment to intervention as the techniques are identical. When used as an intervention, make use of the Maitland grades of mobilization to dose your techniques according to your goals. Check the video in the top right corner to learn more about that. Okay, you've reached the end of this video. If you want to learn how to assess and mobilize the radial capsule, click on the video right next to me. I want to thank you very much for watching. Go check us out and follow us on Facebook, Instagram and physiotutors.com for more. I'll see you in the next video. Bye.